Hi everyone, we are back at MedMiracle and today we have come up with a video on how to prepare for dermatology for any competition exam. Most important things for each and every important disease that you're going to face in dermatology, two things that will help you most in the exam is knowing the most important morphological feature of the disease, the skin morphology of the lesion, the specific important lesion, what is the morphology of that lesion and what is the common location. On the basis of these two and then getting help from the rest of the data, you'll be able to solve most of the questions. So these two things and the image, you'll be able to recognize what lesion it is, you'll be able to solve the most questions in dermatology. The major chunk in dermatology specifically from skin diseases would constitute vesiculobullous disorders, something like pemphigus vulgaris and bullous pemphigoid. There are a few other diseases, but these two are the most important. You'll find a question on either of them in every exam. Papilloscomus diseases, need to know psoriasis, its systemic signs, symptoms, what is the management. Again, the common morphological lesion of lichen planus. So these two important things come under papilloscomus diseases. You have to read the chapter on pigmentation. Most important would be for me the vitiligo. You usually do have a question on this. Then you come to disorders of skin appendages, which involves acne, the classification on the basis of severity, the treatment being the most important part. Also in this chapter, very important and commonly asked thing are the alopecias, cicatricial, non-cicatricial, how do they present, timeline, you should know all of that. Coming to the eczematous disorders, atopic dermatitis is the most important by far. Next is the chunk with other systemic disorders having skin manifestations. So important here is are the neurocutaneous disorders, very favorite of all examiners because it helps you to build up a question very well. So neurofibromatosis, Sturge-Weber, tuberous sclerosis, all of these are very important. Connective tissue disorders usually have very peculiar skin manifestations like the malar rash we all know about in SLE, the facies and scleroderma, so you should be able to distinguish them. Then coming to the malignancies in skin would involve the malignant melanoma, the commonly asked question. Also basal cell carcinoma has been often asked. You should know how they look and what are the manifestations. Then cutaneous signs of internal malignancy. This is a very important topic and specifically from the point of view of competition exams. Also, they importance is because they help in saving time in malignancies because sometimes the malignancy appears later than the cutaneous sign. So if you can find out from the cutaneous sign and you can get the suspicion that there might be a malignancy, it goes a long way in saving. Next topic includes different skin infections. Most important from competition point of view is leprosy. You should be able to differentiate between the tuberculoid form of leprosy and the lepromatous leprosy and the whole spectrum in between. Types of lepre reaction, treatment of multibacillary and paucibacillary leprosy, cutaneous TB and different manifestations, dermatophytes, what is the treatment in each case, and the types of STDs, syndromic management in STDs. You should be able to tell differentiation between the types of lymphadenopathy they cause, the kind of ulcer they cause, painful, non-painful. They should be able to help you differentiate the various diseases. And the important is a protozoal disease called scabies. Important to remember is in dermatology 90% of your questions at least will have images, and if you've not seen those images you'll not be able to diagnose the condition. So seeing is diagnosing. If in a subject you need to look at images, it's an important part, then for dermatology it is 10 times of any other subject. For AIMS exam, most important reliable source would be Nina Khanna, the textbook, which is written by an AIMS professor. Usually the question comes from there. And NEET exam, it is usually the first row of the Google images for that disease. Usually one of them is picked up, just like that. These are the few images, the way it would like to remember, and the way you'll be able to have it in your mind all the time solving questions. You should know the structure of the skin, their basic anatomy before you go into pathology. So different layers of the epidermis have to be known, what kind of cell is present in each layer. The melanocytes are present in the stratum basale. What is the reasons for the spinous processes? See, why is spinosum called spinosum? So these are some questions that can often be asked in neat basic one-liners that can help you get an extra mark without doing much. Also, the anatomy of dermis, the skin appendages, like this showing the anatomy of a sebaceous gland and the duct. So you should know what is the relationship and be able to see even on histology. Questions, the way they'll be asked. So this is an example: a 15-year-old boy with a history of foul smelling, bulky stool, and weight loss for last 7 years develops these itchy lesions on his elbow. The lesions have been shown here. And what would be the treatment of choice in this patient? So even before you, if you've seen the image and you know the allied history, that is a foul smelling bulky stool, is most likely the linear IgA disease, and this history points towards celiac disease. So malabsorption, symptoms of malabsorption directly pointing you towards linear IgA. Many a times they'll not ask you directly what is the disease, they'll ask you the treatment, and we all know the treatment here is Dapsone. Again, a 25-year-old female presents to you with a 6-month history of developing flaccid bullae. So you'll approach this question how? You look at the 25-year-old, 6 months history, flaccid bullae, which rupture in 2 to 3 days. It's a suprabasal split. Which are the following statements incorrect with respect to her disease? So this was a question that came in one of the exams. I've not put up all the statements here because this is just to show how the question would come up. So 25-year-old flaccid bullae in and suprabasal split, these 3-4 words would give me the diagnosis of pemphigus vulgaris. So here this is can come on histology as well. On one day, see, they show clearly the split is inside the epidermis, and here it is between the epidermis and the dermis. So this is epidermis and this is the dermis. You can see the difference in the staining. Again, this darker one is the epidermis and lighter one here is the dermis. So intradermal and subdermal split, subepidermal split. Also important in these questions, the vesico-bullous disorders, they can often ask you how would be the appearance of immunofluorescence for antibodies, and this is the typical fishnet appearance of pemphigus vulgaris. This is the linear appearance along the dermoepidermal junction of bullous pemphigoid, and this is the papillary deposition of IgA in linear IgA disease. Next question, again, the way I told you, neurocutaneous syndrome very important. So they'll just give you skin manifestation. A 20-year-old boy with small pink outgrowths arising from his nail bed associated with distortions of nail plate. These are the lesions they are talking about here, and these are called the Cohen's tumors. These are small pink sausage-shaped growths arising from under the nail folds, and they point you towards the diagnosis of tuberous sclerosis. The typical mnemonic being epiloia, which includes epilepsy, low intelligence, and adenoma sebaceum. But this here are the Cohen's tumors, which also point towards tuberous sclerosis. 25-year-old male has pruritic plaques, so it's an age you need to know. Or sometimes even the sex of the patient is important. This is very important in dermatology: pruritic or non-pruritic disease. Morphologically, it is papules. Location is extensors. There is oral involvement. This is lichen planus, and the lesion here are purple polygonal pruritic papules or plaques. So you can see all this itchy polygonal purple pruritic papules and plaques, the 5 P's of lichen planus. If you know, you'll never get it wrong. This here is a 38-year-old male has well-defined erythematous plaques on scalp. So again, 38-year-old male, erythematous plaques, definition maintained. So the morphological, basic morphological feature you should know, and then the location: scalp, trunk and extremities. The added information given here is that the patient has joint pain and nail changes. This directly points us towards psoriasis. So the psoriatic arthritis, the nail changes, and the basic well-defined erythematous plaque point us towards a diagnosis. You can see here 28-year-old female with scaling. So again, scaling is an important thing. You should know in which disease shows scales, what type of scales are shown. Usually help you in a competition exam. Female here may be important, maybe not. Location, retroauricular erythema infusion. So retroauricular is another important term that is being used here. So this scaling, this immense amount of scaling, specifically mentioning the retroauricular area, this is seborrheic keratitis. So it is less erythematous and less well defined as compared to psoriasis. It is another papilloscomus disease. So we need to differentiate them amongst. So from the lesion that we just saw in psoriasis, this is less well defined, lot of scaling, less indurated, non-indurated. So this is seborrheic keratitis. Next, we have a 10-year-old boy who developed this mildly pruritic rash. So it is a mildly pruritic rash. Again, see, usually these things will be mentioned. And the main morphology is a large annular erythematous plaque, the initial lesion. Now we can see there are a number of lesions and it started from the back. This is a typical history of pityriasis rosea. So this is a typical history of pityriasis rosea, and the initial lesion that has been mentioned here is called the Herald's patch. Another important thing that is sometimes asked is that after the initial lesion on the torso of the body, this can take the appearance of a Christmas tree. The lesions can get arranged like the fir tree or the Christmas tree, and that is why sometimes it is mentioned in the questions and is also an important hint. If we have a 12-year-old boy with hyperlinear palms and itchy licheniform plaques in bilateral cubital fossa, his mother is asthmatic, and which of the following is the most likely diagnosis? Hyperlinear palms, lichenified plaques, bilateral cubital fossa. So you have the flexures and you have hyperlinear palms, history of asthma or atopic diseases in the family. So this is a variety of atopic dermatitis. See, you'll see the pattern is same. There is the morphological condition, there is the location, there is an age, and then there is some additional information that just tilts the diagnosis. So if you have to, in every disease, you have to look out for these things. These are the patch test in atopic dermatitis. Useful finding. You have to take these after every 48 hours. Sometimes it can be extended to 96 hours. See the erythema, and also sometimes there is a grading that can be done on the basis of kind of reaction that was there. So this is a patch test done for atopic dermatitis, trying to find out the allergy. This is a type 4 hypersensitivity that is going to do. Here we have a 24-year-old male who presented with facial lesions for last 6 years. This is a typical image of nodular acne, typical history, male patient, androgens being at the heart of pathology. Specifically, they'll mention usually male patients. This is acne. You have to answer acne sometimes, and sometimes they will take the question a step further and ask you the management. So this is a table here which has been taken from Nina Khanna, the textbook, and you can ask them whether it's a nodular type of acne or conglomatous type of acne, and what is the treatment, initial treatment in females. You can also give anti-androgens, which you usually cannot give in males. Coming to disorders of skin appendages, here we have a case of alopecia. So we'll try to decipher what type of alopecia this is. So a 24-year-old male patient with single patch of hair loss for the last 2 months. So usually when you get a single patch for subacute history, and in the morphology we can see that there is a clearance of the skin. There are no variable multiple small or large hair, there are just all hair are gone, and there's some small black dots. On trichoscopy, you can even see, I think you'll be able to see an exclamation mark sign in this. This is a basic case of alopecia areata. So exclamation mark sign, these black dots, clearing of the skin, male patient with sudden single patch of hair loss, alopecia areata. This is a counterpart of another type of alopecia in tinea capitis. Here we can see that there is some erythema which is different from alopecia areata. There is some scaling at the end usually, and this one is caused by dermatophytes. So there is scaling, and the hair, there will be history of easy plucking of hair. They break off very easily. So these all point you towards tinea capitis being the reason of a patch of hair loss. Now coming to infections, as I said, leprosy being one of the most important, a very frequently asked question, the inverted saucer appearance in borderline tuberculoid leprosy. Here we see in lepromatous leprosy, they'll show you on histology a Grenz zone. This is a clearing between the dermis and the epidermis. Here the dermis is filled up with macrophages, but there is a small clearing which separates this inflammation from the epidermis, and this is the Grenz zone. The onion peeling has been shown in this image, is also seen in lepromatous leprae. Now we have this pathology slide of tuberculoid leprosy with multiple granulomas in the dermis here, dermis granulomas, and this is the magnified image showing a giant cell. So multi-nucleated cells called giant cells in multiple granuloma formation within the dermis points toward tuberculoid leprosy. Now coming to the next part, we have the 65-year-old. So we go into the old age group here. Old male presents to you with an ulcerated nodule with a pearly beaded margin and telangiectasia. This is pointing towards the morphology and age group for basal cell carcinoma. So you need to know all these malignancies of the skin as well. They're commonly asked. Here I have put up a table which is comparing all the pigmented diseases. So you should have something like that, comparative. All you need here is distribution, then the lesion, what is the lesion morphology you can see in this image. So on this basis of 2-3 main characteristics, you will be able to differentiate, should be able to differentiate in these diseases. So these are the pigmented lesions of the skin. So it will include the nevi, and then you go towards from benign to malignant, you come to melanoma, basal cell carcinoma. So you will be able to differentiate in this spectrum. Next, this is a comparative table for the various keratotic lesions, increased keratosis, that is deposition of keratin, keratotic lesions. So from here you have the seborrheic keratosis, single lesion here, then going to Bowman's disease, malignancy, squamous cell carcinoma. So again, you should be able to differentiate these. Basically, distribution and the morphology will help you in differentiating these lesions. In this next image, and question here was, a 5-year-old boy presents to you with multiple crusted lesions. So again, the morphology, erythematous halo. Also another thing, this halo is also an important thing that you should note in all diseases. Then the edge, if it's rounded or polycyclic, and these here are showing the honey colored crust. So this is a another thing that you have to see, honey colored crust. These point towards staph infections, and this here is impetigo contagiosa, can be caused by strep also, but staph and strep, most commonly staph aureus. Another hint that I would like to give you in dermatology, sometimes it's not just the lesion that they question you about, it's sometimes the allied tests. So in tuberculosis, sometimes the question can come on the tuberculin test and its interpretation, so you know how to measure it correctly. In dermatophytes, sometimes they may show the lesion, the typical annular lesion with scaling and central clearing, but sometimes they may just give you the KOH mount, or sometimes they give you the slide. This is the sandwich sign showing the fungal hyphae within the layers of the uppermost layer of the skin. So it is not always the skin lesion that may be shown. Sometimes it can come like this on the basis of the commonly asked tests. So even just by seeing the test, you should be able to make a list that if a KOH mount is given, I should think on these lines. and these may be the commonly asked questions. After that, it just gives you a hint. Here, a 24-year-old male has severe pruritus, which is worse at night. So again, severe pruritus, you've already seen in how many questions pruritus is a common, you know, uh, marker that they are giving. So this is a very important thing that you should always try to see when you're preparing which disease has pruritus, which is not. And two of the three roommates. So this is whenever you have certain history where it's spreading very fast amongst the people who are living close by, it gives you indication towards an infection. Similar complaints, and is a lesion. So this lesion here is a burrow typical of scabies. So this here is the scabies. Now here we have a 34-year-old promiscuous man. So the promiscuity referring towards STDs, and you have a beefy red genital ulcer that has been shown here with exuberant granulation tissue. This is a typical ulcer of granuloma inguinale caused by Klebsiella granulomatis. So similarly, you should know the other ulcers that are asked in the exams. So the typical example I'll show you next is that of multiple tender non-indurated dirty looking ulcers on the glands. These are seen in syphilis. So you should be able to differentiate these lesions. Next, we'll come to the malignant melanoma. You should know these criterias which point towards an heavy pigmented lesion being a melanoma. So it will be asymmetrical, and then there should be the irregularity in the borders. It's a variegated color. So color means multiple, here means variegations. Here you see something light, then this is dark. So variegation within the lesion points towards it being a malignant melanoma. Then diameter more than 6 mm and elevation. So these A, B, C, D, E of pointing towards a malignancy. This you should know in case of melanoma. Here we now come to the cutaneous signs of internal malignancy. In this image, we have necrolytic migratory erythema associated with glucogenomas, and these are basically these lesions seen on the buttocks, groin, and the lower legs. There is usually a ring-shaped red area initially, and ring-shaped red area which becomes, forms a blister, then erodes and crusts over, and is quite itchy and painful and suggestive of glucagonoma. Another example is the erythema gyratum repens, which is the wood grain appearance of concentric, mildly flat to raised erythematous lesions. You can see here the concentric lesions present on the trunk and extremities. Again, signs of internal malignancy like lung CA, breast CA. They can predate the malignancy and thus again, point us towards an early diagnosis. This here is a newborn with ensheathed in a shiny membrane. So this is another thing who was ensheathed in a shiny membrane with ectropion and eclabion. This is the lesion that has been shown here, the scaly lesion, these lines. This is another example that I put up because sometimes the question is asked on the inheritance pattern. So in dermatology, the conditions which have a specific inheritance pattern, may it be autosomal recessive, X-linked. These are important questions that are often we have seen that they've been asked in the examinations. This is a case of lamellar ichthyosis, and this is a colloidal baby where the newborn is ensheathed in a shiny membrane and an inversion of eyelids and lips. So this is basically caused because of defect in the gene for transglutaminase here, and the membrane is shed, and then you give these brown appearing to be as if pasted kind of scales that are present. So again, this is an example where the image is important and the inheritance pattern is the pointer that usually is present. A similar inheritance pattern is sometimes given for the X-linked incontinentia pigmenti. So this is another example of such a question. With this, we come to the end of the video. We've covered most of the topics that are usually asked in dermatology and how to attempt certain questions, what to read in each topic, what to remember in each topic. So, at least finally, I want to emphasize the importance of working hard and working smart. A lot of people work hard, but not everybody is able to get good rank because they don't work smartly. So, work smart and you'll definitely get a very good rank in your competition exams. Thank you.